Empowered Nurses. It's Lorie Brown from empowerednurses.org and yournurseattorney.com. And we're here on the COVID-19 Survival Guide for Nurses and Healthcare Professionals. And thank you for joining us. We have a really special guest today. Her name is Barbara Phillips, and Barbara is interested in microphotography. And you're going to learn about what microphotography has to do with being a nurse practitioner and doing hypnotherapy. So stay tuned. Welcome, Barbara.
Hi, Lorie. Thanks for having me.
I'm so glad you're here, and thank you for contributing to these nurses. So Barbara's like a jack of all trades. She has a very interesting background. She is a nurse practitioner herself. She teaches nurse practitioners how to grow businesses, but she also does hypnotherapy, right?
Mm-hmm. Yeah. So hypnosis, a lot of people say, what the heck is that? And I have to tell you that originally when I started talking about hypnosis, I almost was in the closet about it, because a lot of people don't look at it as something that is real. And actually it has a lot of science behind it. There's a lot of research behind it, a lot of evidence about how hypnosis works and how the mind works. And as we learn more about neuroscience and everything that is going on, the keys are in our mind. It's like, it truly is, because I'm a little bit of a Trekkie, it truly is the final frontier.
Yeah.
So, but going back to the macro photography, what macro photography really is it's really being able to look at things and photograph them that you can't see with your naked eye. So it's not so much looking at it using the microscope diopters, but looking at it 1, 2, 3, up to 5 times what you would normally see. And when you're looking at those little details, I mean, you can look at a flower, but then you're looking at maybe just one of the stamens, and all the detail is in there. And I think for us, we have so much detail in us, and so much magic inside of us that really our minds can kind of let it go and let us blossom, let us increase our resilience, that sort of thing. So anyway, that's what that's all about.
So interesting. And it's like you are enlarging the details, like we're looking at the small parts of our mind and enlarging them to see the big picture.
Right.
Yeah.
And and as we learn more about the neuroscience and how we're constantly making neural connections, the synaptic connections, and how we're also always pruning away the things that are not helpful anymore and things that we don't need, when you start looking at things like guided imagery or hypnosis or mindfulness or NLP, neuro-linguistic programming, and a host of other things, we can help direct what we're getting rid of. And I do that a lot with my clients in terms of their fears and anxiety, being able to sleep, and also things, of course, I do a lot of medical stuff, so IBS and chronic pain and fibromyalgia and those sorts of things.
Right. Wow. Interesting. So what can, during this COVID-19 crisis, what can hypnotherapy do to help our viewers?
There's a lot of different things that we can do. So as we were talking earlier, I'm doing a weekly webinar to teach, or a Zoominar, I'm calling it, to teach all healthcare providers things that they can do to bring down their stress. So I'd like to share a couple of things that aren't necessarily hypnosis, and then I'd like to guide people through a self-hypnosis exercise that they can do for themselves. And we didn't talk about this earlier, Lorie, but I do have a handout that people can have. Okay, that actually will guide them through that so that they can keep practicing and doing that themselves. So the first thing that happens is a lot of times we get fear, we get stressed, we get anxious. And when we're anxious, for many of us, those thoughts just start going round and around and around in our minds. And pretty soon we can't even really see things clearly because we're so stuck in those thoughts. The theory behind all of this is that our thoughts just kind of get stuck in one side of the brain or the other. And so with this technique, it's called bilateral stimulation. It's also been known as bilateral hemispheric stimulation. There's a bunch of different words for it. I just call it, bilateral stim. And what we're doing is these thoughts, the metaphor that I use for my clients, because I'm here in Missouri and I-70 is the major thoroughfare. And I tell people it's our anxiety or thoughts are like being on I-70 at 5 o'clock in the afternoon on a Friday afternoon, and it's storming outside and you can't go anywhere. The traffic's at a standstill. And what we want to do is to clear out that traffic. And so one of the ways to do it, I'll just use a chapstick. In the office, I have little squishy brains that I show this to people with. And basically what I have my clients do is I want them to think about whatever is making them anxious, whatever, even a craving. I've used this on smokers who are having cigarette cravings and it takes them away. So just think of what it is, rate it on a scale of 0, which you're fine, to 10, we have to kind of peel you off the ceiling. And so when they get that number, what I have them do is basically follow me. And it's a little bit hard to do that here, but I just have my hands out in front of me holding this item, and we just pass it back and forth. And so what we're doing is you want this to cross the midline, because now we're stimulating both sides of our brain. So of course that we know that, this side is going to stimulate this side and vice versa. And so I just have them do this. And exactly, Lorie. And I even will teach people to do this. Once they've done this often enough, you don't even need to be passing something back and forth. If you're in a meeting, just put your hands underneath the desk and tap one knee and the other, one knee and the other. And what people often find is in about 60 to 90 seconds, that feeling of anxiety, that craving is gone.
So when you
gone.
The tap the knees, do you cross tap?
No, you don't need to cross.
You don't?
Because you're still doing one side and the other side, one side and the other, one side and the other side. Okay? So you're still stimulating both sides of the brain. I have also, we teach this to children because they're really quick to pick it up. I've taught this to therapists who have really anxious groups of people, particularly those that are recovering from drug and alcohol abuse. And they can't sit in the group sessions. And I've taught them to do this, and it works beautifully. I've even personally used it with someone who is confused, somebody who has dementia and they're agitated. And really, you can just, if you're standing behind them, just start tapping side to side and talking softly, and it brings them right down. So it works really well.
So this is a technique nurses can use when they're getting report, if they're getting report sitting down.
They can do it when they're getting report, and once you've started doing this, you don't need to do the actions, you can think about it. So I've done it so much that I can just do it in my head and I'm getting the same kind of a result because I think about how it feels and having each side of my body being stimulated, and it really can calm those feelings down. I've brought people out of panic attacks doing this. So you can do it when you're getting report. You can do it when you take a moment, if you get that moment, to step into the bathroom. So, wherever you are, you can do that particular technique. Nobody needs to necessarily knowing what you're doing. But on the other hand, this is something you can teach your patients to do. It's simple. You don't have to remember a lot of different steps or a lot of words. You simply do this.
That's great.
So yeah, it's nice and easy, and it works beautifully. And I've just seen it work in so many different situations. It's unreal. So it's my favorite thing that I like to teach. The next thing I teach my clients when they come in, and all of these things, this is what I do in my some of what I do in my first visit, regardless of what the person's coming in for. Because if you think about it, almost any medical condition has anxiety. There's an anxiety component. There's a craving component if somebody wants to come in about weight loss and that kind of thing. And so we start with that. But the next thing that I do is I teach something called peripheral vision. And I originally learned this from somebody out of New York, Melissa Tiers, and she actually has a book I recommend. You can get it on Amazon. It's the Anti-Anxiety Toolkit. And basically what happens is, again, when we have thoughts that are going round and around, it's like you don't have enough space to really think about what's going on. And so with peripheral vision, what you want to do is pick a spot. Doesn't matter what it is. If you're walking down the street, it can be the back of somebody's head. If it is, I've actually had clients who've used this with their partners when they're having an argument. And it works really well. But just look at whatever it is that you're going to focus on, and then just kind of defocus your thought and your focus, and begin to look at what's around it. So I'm going to look at my head in the picture. And so as I look at my head, I begin to become aware of those bricks and maybe the plant and the candle and the headphones that are there, and perhaps what's above me and what's below me. And as I'm doing that, I'm looking at everything else that is not that thing that has me upset, that has my thoughts. And what people begin to notice is that the noise inside the head just quiets. It just can quiet your world so you can take a breath and breathe and feel like you have some space to work in. Works great for fears, for anxiety, for anger, and just being able to get yourself back on track, to recenter yourself. When I first learned it, I had to practice it a while, and now it's really easy for me just to, like, I'm looking at the camera right now, and I can just go, and notice everything else that isn't a camera. So works really nice, really, really nice. I get a lot of good feedback from that. So I encourage you to do that and to try it. So you've got a family member, well, maybe you don't, since a lot of us can't visit in the hospitals anymore, but you've got somebody, a resident, another coworker, they're just, you can't even, they're panicking and you can't kind of get yourself centered. You can just look at them, defocus your thought, and go into peripheral vision. And a lot of times people, when I do this in the office, they just go, oh, and feel so much better. So that's another technique that I will often teach. And then the third thing, and I'd like to share this with you, is something called getting into the zone. And it's actually a self-hypnosis technique. And I usually run through this with my clients at the end of our first session, and then give them a handout so that they can practice it themselves. People who do this consistently notice huge changes, even though we don't even address anything. We have such an ability inside of us to make changes, and regardless of what your belief system is, whether you call on a god or the goddess or Buddha, Allah, Mother Earth, it doesn't really matter, because all of us have inside of us a highest inner wisdom that knows more than we know, that has been with us from the beginning of time. And sometimes we don't listen to it very well. So I think all nurses know about listening to their intuition, their gut. That's part of that. And so the zone is really nice in that you can do it. You can even do it 2 to 3 times a day. Do it for 2 minutes. So when you get that, that rare, coveted potty break, you can sit there in the stall or stand there in the stall, whatever you're doing, and just do this. So what I like to do when I teach this, because I do it differently every single time, I try to follow the handout, and I've got that in front of me so that I can just go through it with you, and I'd like to make sure that all of you get it as well. So you can do this exercise first thing in the morning or last thing at night, or like I said, several times during the day, whenever you need that mental vacation, you know, and again, it only takes 2 to 3 minutes maximum. So you want to set your own mental timer, and we do have them, and you can do it for 1 minute, 2 minutes, whatever you think that you have, because you'll automatically kind of come out of this when you're doing this. Now, if you're going to sleep, of course, don't do that. Get yourself comfortable wherever you're sitting. So if you're sitting in a chair, you're sitting in your car, you're sitting in the stall in the bathroom, and go ahead and close your eyes. Just allow yourself to close your eyes and just to focus your mind. That's right. You don't need to think about anything in particular right now. And I'd like you to gently bring your attention inside your body. And then get a sense of occupying all of that space inside your body. Get down into all the little nooks and crannies, all the way to the bottom of your feet, to the top of your toes, to the top of your head and your toes. And as you do that, you might notice that you begin to relax. And then allow yourself to have a sense of expansion, letting that awareness that's inside begin to expand outward, perhaps all the way around your body, maybe 3 inches, 6 inches, beginning to move it out to a foot, to 2 feet, 3 feet. And as you're doing so, you can relax even more. And begin to let that awareness move even further outside your body, perhaps taking up the entire room, allowing your awareness to go beyond the city that you're in, go beyond the earth, go all the way to the stars. And you can notice how much you can relax. You can notice how good that feels. And some people, they like to become totally aware of the faces of the people that they love and the people that love them unconditionally. And you can allow yourself to float and to drift, to rejuvenate, to let yourself refresh and recenter. And then begin to bring that awareness back into your body, back to the planet, to the room that you're in, all the way to your body. And as you come back into your body and notice those sensations, notice that your cells inside are jumping for joy because they've been renewed, they've been refreshed. And you can say to yourself in your mind over and over again, I live with a happy heart, a peaceful mind, and a playful spirit. I live with a happy heart, a peaceful mind, and a playful spirit. And you can just say that over and over again. And when it's just about time for you to return to normal awareness, you can even shout to yourself inside, I deserve to live with a happy heart, a peaceful mind, and a playful spirit. And when your time is up, you can just bring yourself back into the room feeling refreshed and feeling recentered.
I didn't want to wake up.
Isn't that amazing?
It
It's 2
is.
minutes.
Wow.
It's 2 minutes. It's, you know, when I do this in the office, I actually do it at the end of our hypnosis session for whatever we've been working on. And so, you know, and bringing people up and then letting them go back down, and they just, you know, it's like, no, I'm sorry, you do have to get out of the chair now and go home. But it's so simple. And sometimes, you know, in fact, all of these 3 techniques that I've shared, they're simple. And the danger is that sometimes people underestimate the power. Our minds are so utterly powerful that they can do so many other things. So they can make you healthy, they can make you sick. We all know that. And so use this to recenter yourself, to reduce those stress hormones that are running through your body. Your body does not need that excess cortisol right now.
Yeah.
But instead, it needs to just calm down and start feeling good, allowing yourself to stay healthy and allowing yourself um, to be able to function in the full capacity that you can do. Because all of us, all of you are amazing at what you do. And sometimes we just need to recenter a little bit, and these things can help you do that.
Yeah. And, you know, my biggest thing is how do you remember? And I would suggest, you know, creating a habit. So if you always do it at a certain time, for at least 66 days, it'll become a habit. So what things can you do to remind you, like every time you go to the bathroom, to do the centering, or the you know, using both sides of your brain, or whatever it is for you.
Yeah,
But if
yeah.
you make it a habit, it'll be a lot easier, and these tools will serve you.
Right, right. And certainly anytime you start to feel maybe a little like, ooh, getting a little anxious, first of all, spend some time becoming aware of the sensations your body is giving you, because your body's not going to lie. It's going to tell you exactly what is going on, even if your mind has not yet caught up to it.
Right.
So if you're aware of what your body's doing, as soon as you feel that maybe a little bit of a heart rate or your breathing has increased a little bit, you can do any of these techniques that we've shared with you. Doing this, or actually the peripheral vision, is so nice because nobody needs to know that you're doing anything at all.
Right.
And people are going to look at you and wonder, how are you staying so calm? What are you doing? What's your secret? So please feel free to share any of these techniques with them, because we all are in this together.
Right. And so where can we get the handout that you mentioned?
I can either give it to you and you can add it as a download when you're doing this, whatever works. Or the other thing, and I'll share the link with you, Lorie, but what I started last week at the time that we're recording this, every Wednesday at 8 p.m. Eastern, I'm doing a Zoominar for healthcare providers, self-care for healthcare providers. And we're doing different techniques, different imaging, some mindfulness, some NLP, some creative visualization, all kinds of different things every single week. It's only for 30 minutes, so you can pop in when you want, you can leave when you want. I do ask that people be on camera if at all possible, because it helps me you know, make sure that I'm pacing things according to what your needs are. But that's 100% free. And I'll do it for as long as we need it.
Yeah. Yeah. I'm hoping that this series, you'll find so much value in it that you're going to continue to use it long after this
Yes.
COVID-19 is over. But
Yes.
give me the handout. I'm happy to put it in the email to remind people about this program.
Right. Right. I'll do that. I'll share all of that with you.
That'd be great.
So,
And
yeah.
if you give me the Zoom link for your Wednesday nights, I'm happy to put that in
Right.
as well.
Right. Right.
Okay, well, thank you so much for being on this
Well, Lorie,
program
you're very
and sharing
welcome.
your knowledge. It was really interesting. I'm actually loving doing these interviews. And if you, our listeners out there, are liking this as much as me, please share. have your colleagues, healthcare professionals, nurses, you name it, go to empowerednurses.org/COVID so that they can get all the resources as well. And thank you so much for being here. Thank you for being the true heroes in the story. We love you. We appreciate all that you do. Thank you for being there. And just be well, because if you don't take care of yourself, you can't take care of anybody else. So until next time.
Yeah.
Thanks, everyone. Bye.
Bye-bye.